All right, later this week, we should learn more about a deadly measles outbreak in Texas. Almost 160 cases have emerged since January, leaving nearly 24 patients in the hospital. Sadly, a child has died. Doctors here in Memphis are monitoring the situation, including Dr. Nick Highsmith, the medical director of infection prevention at Le Bonheur. Doctor, welcome. Glad to have you here at 3 o'clock. Bring us up to date. What are we hearing, especially here in Memphis and the state of Tennessee as a whole? Have we had any cases of measles?
Right, Alex. So no, we haven't had any cases of measles as of right now. We're monitoring the situation in Texas and New Mexico and some other parts of the country really closely. We know that measles is incredibly contagious, so we're just staying vigilant here in the Mid-South, but luckily so far we haven't had any cases.
Doctor, as you just pointed out, with measles being so contagious, is it airborne? Why should we be so concerned about it?
Right, so yes, it is airborne, and I know we're all very familiar with things that are airborne since we just came out of COVID, but yes, measles is airborne. It's incredibly contagious. It's one of the most contagious infectious diseases that we know. For example, if one person walks into a room with 10 other people and this person has measles, and none of the other people in the room are infected, roughly 9 or 10 of those other individuals would get infected with measles. It's incredibly contagious.
That's pretty scary there, to say the least. What about it being deadly? Obviously, we spoke earlier about at least one child having died from it. What do we know about that?
Right, so I'll just give you a few numbers. Back in 1963 is when the vaccine was introduced. Prior to that, we had about 48,000 hospitalizations a year in the United States from measles. And of those, roughly 500 deaths per year. So it's one of those things where, you know, we see the complications the more cases that we have. So unfortunately, the more and more cases we get, the more complications we're going to see. It can be fatal. Kids can get pneumonia from it. Kids can get meningitis or encephalitis where their brain swells. Those are the complications that we worry the most about.
Let's talk about the vaccine because, you know, you have a lot of people, as you and I've talked many times before, as you well know better than most, you know, sometimes people are very leery about vaccines. When it comes to the measles vaccine, what is it essentially? How safe is it? How effective can it be?
It's incredibly effective and incredibly safe. This is one of the vaccines that we've been giving for decades here in the United States. It was first licensed in 1963, and then it had a little tweak in 1968. It's what's called an attenuated live viral vaccine, and I'll explain that a little bit. So it's the virus, but it's a weakened form of the virus that can't cause an infection in an individual, and they inject that and your immune system makes antibodies to it, and that gives you lifelong protection. So after 2 doses, so kids will get one at about 1 year of age and another one at about 5 years of age. After that second dose, they're 97%. It's 97% effective in preventing measles.
That's very effective, to say the least.
Yes, sir.
You might have some adults also wondering, wait a minute, what about us? We know about our kids and the need for them to get it. What about adults? And if you don't know your vaccination history, you know, since it's been so many years?
Right, so that's a good question, and we get that a lot. So prior to 1957-ish, we assumed that everyone had had measles as a child because it was just so prevalent and so contagious that all kids got it. So those individuals are older now, and we consider them to have immunity in most circumstances. However, if there's any concern, you should see your primary care doctor because you can definitely receive another dose if there's waning immunity, is what we say, or if there's any concerns about your immunity.
So that second dose, we shouldn't be concerned about that. What about a blood test? Does that also show us potentially if we still have those antibodies that we need?
Yeah, so you can get a blood test. We do that often in the healthcare field because we have individuals that work in our hospital setting that were born prior to 1957. So we check their blood to see if they have antibodies, and if they do, we call those folks immune.
That makes a lot of sense there. One reason the problem has been so huge, especially in the state of Texas, is it because there are so many people who are unvaccinated? Do we know, Doctor?
Yeah, Alex, so unfortunately it's a pocket of individuals who are unvaccinated or under-vaccinated is what we say. So the kids get this vaccine at 1 year of age, so those kids less than 1 year of age are incredibly vulnerable to the disease. So any time there's an unvaccinated individual in the community or a group of unvaccinated individuals in the community, they can really quickly pass that on, and then it'll get into that large group of kids that are under 1 who haven't had the opportunity to be vaccinated.
So quickly here, Dr. Highsmith, the last thing you really want to drive home, you really want folks, parents especially, to know?
I want parents to know that vaccines are safe and effective, and that is the best way to prevent these diseases.
Dr. Nick Highsmith, we especially appreciate you doing and making this house call for us here at
Great to be here.
WREG. Always good to see you. All right.